most prominent names in ophthalmology. His experience spans over 2 decades with over 30,000 surgeons. Awarded the gold medal by the Indian Intraocular Refractive Society for contribution in the field of ophthalmology. Welcome, Dr. Mehta. It's a pleasure to have you here with us on our
Thank
show.
you for inviting me, Parminder. Thanks so much. And a very good morning or
Okay,
afternoon
so we'll
whenever you
get
have it for your parents from the school.
right. So, Dr. Mehta, we've seen that, during this pandemic, the daily screen time has seen a big jump. And kids are spending far more time with screens than what they were before the pandemic. So we do know pediatrics has published a statement in response to the new coronavirus, and they've taken a very different approach to screen time. So they are not really talking about any set limit for the screen time. However, we would want to make sure we have a healthy relationship with screens. So I wanted to begin with by having you tell us what is the maximum time at a stretch for which we can expose the children to the screen. So, as you know, we have online school and there are lessons which are going on online. So at a time, at a stretch, for how many minutes can the children be exposed to the screen? And this is for the early years as well as for the primary.
Okay, let me extend it to even later years to the parents. Let me give an answer for the whole
All
family
right,
as such
sure.
right now. So during the pandemic,
Yes.
the COVID pandemic, the bigger problem has been the pandemic for the eyes because of the lockdown and because of staying indoors and the office is at home, school is at home.
Right.
So 8 to 10 hours of
Right.
laptop, iPad, tablet, and whatever on that. Then 4 to 5 hours of Instagram for the young age group, the Facebook for the elder age group, and WhatsApp. So screen time on 3 to 4 on that, and then to relax Netflix and Sushant Singh Rajput case. So the
I know.
media, which means almost 12 to 15 hours on an average, the whole family is spending on different equipments on screen time. So I would not blame school for that. This is
Hmm.
this is
That's good to
use,
hear.
as I tell you, there is use, misuse, abuse,
Hmm.
and overuse.
Oh,
So
okay.
this is a huge pandemic which I've seen. In fact, I'm the president of the Indian Intraocular Implant Society. We are conducting a survey across the country. I'm going to send you a questionnaire. You can send it to your parents. You can send it to them that we
Sure.
will find out how deeply the whole problem has evolved because office have come home, schools have come home, and the child.
And there is really no end to an office day. I mean, earlier we used to walk away at a certain time, but now I've seen it just goes on till late 10,
Is
11.
this a
I've
complaint
seen
to the school authorities,
people,
Parminder? Is this a complaint from your side to the school authorities?
not really. I'm just
I
stating a
know, yeah,
fact
yeah,
that I've observed.
I know. I am just kidding. What I'm trying to say, yes, there has been no time for anything, and every given moment,
Right,
minus a few moments here and there, have been screen time. And which is
right,
why I want to send a questionnaire. I want parents also to answer this question. So let's not blame the children for this.
right,
Children are the last in the whole game, and they do exactly what the parents do. And
correct.
everybody is tremendously into WhatsApping and getting up messages and forwarding and what's going on here and there. So my request would be that use them, don't misuse, don't abuse, and don't overuse.
Good.
Okay, it's like going for a walk. Your legs
Right,
were meant for walking, but that doesn't mean you keep walking 16 hours in a day or keep doing those exercises for 16 hours. Anything that you do in overindulgence will always give you problems. You
right.
don't have you don't have to stop your sugar, but then anything in excess is bad, like your diet.
Moderation. Yeah. So be
Everything,
mindful of what we are doing, right?
correct. Everything in moderation, including moderation, should be in moderation.
All right.
So that
Okay.
So
So
what
the other
I'm trying to tell you is that
factor,
what they have to do in school, they have to. There has been a lot of things which have happened in the past. The statistics are going to change very rapidly in these 6 months, and this survey is going to help me in doing that. We have come out with a lot of solutions nationally. I've done that because I spent 4 months on research on this activity of what's going on with the eyes. Unfortunately, they have taken the maximum brunt. People could not go to the gym, they could not go to the temple, and
yeah,
minus the corona hospitals. Back at home, the pandemic of eye has increased phenomenally. So, well,
right,
there is something called computer vision syndrome, which was there earlier on
right,
described by for IT professionals. So, wherein you have burning, itching, smarting, and all that which can happen. So, the ideal principle given is 20-20-20. So, we are in the year 2020 right now, and vision also, good vision is called 2020. or 6:6. Normal vision, when you read the last line on the chart, is 20/20 or 6:6 vision.
So
Yesterday,
you sit for
incidentally,
20 minutes and then you look away for 20 seconds,
yes,
which is
I'm coming
something
to
which
that.
is 20
Yeah,
feet apart. Is that what 20, 20, 20? Yeah.
yeah, I'm coming to that. Before that, I was trying to tell you something important.
Yeah.
Yesterday was the International Sight Day.
Okay.
And what we are trying to give, yesterday we had major seminars across the country to tell people that all those things in this world which you could not buy with your money, that
Mm-hmm.
means a couple of trillion dollars could not buy that. That
Mm-hmm.
means water, the air, the
Right.
sand, the human body,
Right.
including the eyeballs, was given free to you. Your responsibility was to take care of them.
Right.
All the parents are very proud to have the BMW and Mercedes being serviced every 5,000 kilometers proudly. Even a small scratch on their car, they will burn their heart for a few days. But anything happens to the body is taken for granted. So that is something, please value. All that was given free, because the only time you will value them is when you lose it. That includes
Right.
relations and family. I'm talking with respect to eyes right now. So I'll
Right.
restrict to that. Yes, I'll have to the answer to your question of 20/20/20. Every 20 minutes, blink 20 times, look outside for 20 seconds, look into a greener area, look elsewhere, change your gaze, any severe movement. It's like you're doing your biceps, triceps. You can't stretch your muscles. The eyes
Mm-hmm.
also have muscles, internal and external muscles.
Right.
They are the ones who are undergoing constant stress. So let them, give them some time to breathe. So eat well, sleep well, oxygenate well. That is
And
very
any
important.
particular distance that we need to have between the screen and the child's or the eyes? Okay.
18 inches at least. Basically what you're saying, 1.5 feet. That is the standard reading distance that has been there for
Okay.
newspapers, for everything.
Okay.
So not, don't worry so much about the distance. They won't be able to see you and me also. Even if I go very close, I won't be able to see, and you won't be able to see if you go far. So God has naturally designed a few things. Yes, you can't bend down, but yes, around 18 inches is a good idea to have your screen monitor, laptop, and the contrast should be changing. Your glare should be changing so that you can do that.
But somebody told me that the screen should be little down, or should it be at the eye level?
No, the down and the up portion is with respect to your neck and your
Okay.
shoulder and
Okay.
your type keyboard,
Okay.
because
Okay.
there are frozen shoulders and all that which can happen. So that's another story, not with respect to the eyes. So what you really want is something where you are
Not.
comfortable in a sitting posture. If you describe posture, that's another problem which is going to hit people with all kinds of postures: lying down, sitting, sleeping, standing, shirsasan. So people have covered everything possible so that they have all aches and body aches.
Right.
So if you are lying down, then you have a different posture. So don't worry, but keeping that distance is very important. That's
All
about
right.
it.
Okay, also because now we have schools and we have these online lessons, so to speak, we do give them a break in the middle. So I wanted to know from you, doctor, what is the appropriate duration of the break time between two screen sessions for kids? And also, what is it that the kids should be doing at this break time during this time?
Yeah, that's very important. Now, who's going to carry it? Who's going to discipline the child at home? Because in school, the biggest thing, I'm on the advisory board of Jamnabai here, and I know the biggest complaint parents have here. Uh,
Hmm.
Children are very well behaved until they are in school. Outside school, they are totally misbehaved. So it's the responsibility of parent, which I would say from the management perspective, that this is something which is not taken very easily by people, and they expect children to behave very well at home
Right,
also. The same discipline doesn't happen. So yes, what we want between two classes is let them just run around, play a little bit, get like a nursery child. It's nice to see a small nursery child.
physical
They suddenly
movement.
get up, they run, they play. They have their own discretion to do things. So after a class which is
Mhm.
concentrated, say 40 minutes class that you have, anyway, by the time one
Right,
teacher gets in and the other teacher gets out, would be around 5 minutes kind of a scenario. That's the
right.
kind of break that you can give them with your
Okay,
intervals for your
okay.
short recess, long recess, whatever that you're giving.
Right, right. Which we do.
Yeah.
Okay, so now that we know that education has been influenced a great deal by technology, and it's possibly something that we will now can never live without, and schools are obviously going digital, children are accessing content on their phones and laptops and desktops. So my question is about the choice of hardware. What is it? My parents have been asking me a lot that is it okay that the children are accessing this content through a mobile screen? What would you want to say about that?
Yeah. It doesn't matter actually. God knew that we will misuse and
Okay.
abuse a lot. So He's given you a standby proportion. He didn't give you one, He gave you two eyes,
Right.
though you can see with them. So there is a lot of standby proportion which has been given. So it doesn't matter. None of them have been proved to give rise to more radiations than the other one. But my study will give me
Okay.
something, some more answers in the
Okay.
next
That's
6 months. So it doesn't matter if it's your tablet or a
okay.
screen, or it could be a Mac, or it could be your regular PC on a tablet, or your laptop, or whichever way.
Okay. So now moving away from screen time, what we are going to do is we are going to talk about some eye problems, that people get from time to time. Many of these problems are minor and they don't last too long. So the most common preventable eye problem that I think kids get it is the pink eye, or you call conjunctivitis. So doctor, what do you do when the children have this, and can it be prevented?
You asked a very, very important question. It is not a small thing. Remember one thing: when the
Okay.
body complains, do not neglect your body. Like a small child is hungry before they can speak, they will cry. If they have pain, they'll cry. They are sleepy, they'll cry. They are upset, they'll cry. They will cry for everything because they don't know what to tell you. Same way,
Right.
your body will complain to you. If you're not sitting in the right posture, you will get backache. If you're
Right.
not sitting correct. So pain and all these body languages which you have are your great friends. Try and understand them. Don't neglect them. You said very correctly the first statement, the first part. It happens very frequently and it disappears. No. When it is trying to tell you something like a small child, don't neglect your complaints. It is
Hmm.
trying to tell you. Then when it is coming repeatedly, it is actually telling you, now come on, enough is enough before I slap you. This is how nature gives
Right.
you time. It gives you time to heal, to do a proper rectification. If you don't, then it slaps you. Now, pink eye is not conjunctivitis always. Pink eye could be
Okay.
again
Could be
excess.
any reason. Hmm.
Yes, it could be multiple reasons. I'll name them a few for you. Allergies, because children are very prone to allergies. So spring catarrh, or they could be having some, they start using those uh, deodorants and all that. Suddenly, in a particular
Right.
age, they start, then they put extra, or the things of allergic nature. Basically, we have to figure out, because children have a lot of erythemas, allergy, itches also. So, what is it they're allergic to? So, reduce the allergic out. Now, the pink eye conjunctivitis is not very common. Conjunctivitis happens only in specific seasons. So, every pink eye is not conjunctivitis. There's a huge differential diagnosis for that.
Okay.
And let me hint to you a very important thing which most people neglect, that it could be a sign of an early number also.
Oh, really?
When your eyes are getting stretched and strained and you can't see, it wants to complain. It's strenuous to
Hmm.
the eyes. So it's complaining to you. So you've got to get yourself examined as to what was the reason why. It's only your ophthalmologist who can let you know what is going on with the complaint and what to decipher out of that. So
So the
don't
parents
take it.
need to take their child to the doctor. That's most important, I mean.
Absolutely, because all redness is not the same. There is a huge
Right.
differential diagnosis. There's a 100-mark MS question paper for my juniors on red eye.
Hmm. Okay. Another thing that we want to talk about is watery eyes, another cause of eye distress, and it can be kind of annoying. So, what's behind watery eyes, doctor, and how can they be treated?
I'll give you a corollary to the same. The previous answer was the same answer to this also. The poor eye cannot give you pain in your stomach or your legs or your hand or your back. They can only become red, they can water, they can
Okay.
give you redness, fatigue, or a headache. So
Okay.
all these are complaints periphery. It could complain like this, it could complain like this, it could complain like that. So everybody's individual can have a different kind of a complaint.
Okay.
That's
So,
how it.
we
Some
cannot
people,
really
some people,
decide uh,
correct. So let the doctor
unless.
decide what is the cause of the. You may have a running nose, you may have a allergy, and then you'll have watering of your eyes. So,
And what about dry eyes?
oh yeah, fortunately, children don't have, the adult have. So that's a huge, huge thing which is happening. That's why I've created a questionnaire for that. There's a very complex science. Your tear film is not a very simple water. Your tear film
Okay.
is made up of three layers: mucin, aqueous, and lipid layer.
Okay.
So every time you blink, it's not funny. There is a
Hmm.
lacrimal gland situated here, which is secreting the fluid. There are goblets, there are meibomian glands secreting lipid layer here. so that the water does not evaporate. You know how when you put oil or ghee on water, it does not evaporate. So there is
Right.
already a sebum which is secreted on top of the watery layer, so it does not evaporate very quickly and you don't get dry eye. And every time you blink like a viper, it cleans your eyes. And then there is a
Okay.
gutter from the nose to the mouth, which lets all the filth get into the nose and into the acid in your stomach. So dry
Okay.
eyes again, multiple things for especially women and all, hypothyroidism, menopausal, hormonal changes, young females,
Oh, so
PCOD,
many things. Anything can cause dry eyes. Okay.
yeah, vitamin D deficiency, B12. Now you understand one thing.
But
Uh,
I've seen people use some eye drops, refresh tears, that for dry eyes, and they say it's fine. And
because they don't like to go to a doctor, they have allergies, so they use whatever is given, or they'll go to the chemist. आजकल क्या दवाई डालता है तो बोलेगा पायल
okay,
मत डालो. So because we take it for granted, no, it was given free, so that's why. But every watering is not the same thing. We have to determine the cause because they'll keep putting the same thing again and again. There is a science
right.
behind it. There's a huge science behind dry eyes, huge, and it's increasing at an alarming rate, especially in the metros and everywhere. Lack of sleep, excessive screen usage, hormonal changes, milk and milk products, and the amount of hormones being pumped into your body, hypothyroidism, menopausal, contact lens users, and air conditioning directly, wind coming into your eye. And when you are concentrating on the
Okay.
screen, you tend not to blink. You have 7 to 8 blinks
Right.
in a minute. And when you are looking so intently, you will not blink. So the tear film will evaporate.
Hmm.
So you
Okay.
realize it's not a simple, it's a very simple question. The answer is very, very complicated right now, extremely complicated. That's why I want you to fill up that questionnaire, which I'm going to send. And then I'll show you some videos if you wish to see something.
All right. The experience of the likelihood of experiencing an eye twitch at some point in life is relatively high. So, which brings me to our next question: what triggers eye twitching, and how can we stop it? And is it something that we need to be really worried about, or no? I mean,
Good question. Again, the same thing, my dear lady. I'm going to tell you the answer is that eye twitch is nothing but the eye is trying to tell you something. The eye muscles are tired, and when they are tired, they like other muscles, they will flicker. You know, when you have some other muscle flickering somewhere, so they are tired and they are flickering. So eye
okay.
muscle can the flickering of the eye shows, and you know how it is. Earlier, it used to be told that you'll get good luck, and then came the idea that if you get twitching in the eyes, you'll get good luck. You know where
Aankh
it
padak rahi
started?
hai. Yeah, yeah,
You know how it started? Actually, it
of course.
started because when you work late night and you work very hard, your muscles get tired and you get twitching. So the saying started that you'll get good luck. Damn it! Of course, if you work hard, you're going to get good luck. So
So
that's how the whole.
splashing cold water and all these things won't help because that's what's been told to us, by our grandparents and all. कि
That pouring
ठंडे पानी
water,
के नीचे मारो. Yeah.
pouring pouring water. Not really. Not. It's not going to help you so much because
Okay.
the one of the thing that you don't do is pour water in your eyes.
Oh, really?
Yes, because your water. Tell me when was the last time your tank was cleaned? Tell me.
I don't know.
All right, very good. Now, so which means if there are bacteria and all that in that tank, you're going to keep washing it. Now,
Hmm.
you made some interesting vegetable for your family and your children. Lovely gravy you have made.
Right.
Okay, and then I put 1 liter of water in it. What will happen?
Hmm.
I just explained to you the tear science. That the tear film is a compound which is gradually micron secreting stuff to make a beautiful tear film. And what you did by putting water, you just diluted it 1,000 times. So you felt good for a fraction of a second, and back to square one, you became dry again. You
Okay.
misappropriated the whole situation. Make
I'm
sense?
glad I've asked you these questions because we thought
Yeah,
that,
these are more adult questions
yeah,
actually.
that we can just buy some over the counter and we can put some teardrops and we can just splash our eyes with cold water and it goes away.
Yeah, it sounds very simple, but once in a way it's okay. But if it is happening again, remember one thing I told you, a very important thing in the beginning, that the first thing is the body is going to tell you something. The body is trying to tell you something. Do not neglect that.
Right.
This is what I'm trying to tell you once again.
Right.
Do not neglect. It is trying to tell you
Okay.
something very important. Each one of them, there are thousand answers which I can get, and the human body. And I'll tell you something. Your eyes, it's not in the movies or in the songs only. That eyes reflect the rest of your body, and from the eyes we have picked up from thyroid to breast cancer to brain tumor to blood pressure to diabetes to a thousand things which we can pick up. How when you can make out your family somebody's tired or they are droopy
Okay.
eyes, you know they're not slept well. They don't even have to say anything.
Right.
There are thousand things which can be made out by a simple eye examination.
So how often should we go in for an eye exam? Twice in a year?
Oh, 6 months, maybe once in a year in the beginning. And if you have problems, twice in a year. But now since this is for a school, children grow very rapidly. Their hormones change suddenly.
Right.
So if they
Right.
have a number or otherwise, every 6 months, ideally, Diwali and May vacation, we have an exodus of children coming. So
Hmm.
that is the ideal
Okay.
scenario. On this, I will tell you something
Okay.
important.
So, doctor, in early childhood.
Go ahead, go ahead,
Sure.
go ahead.
Sure. No, no, no. I please go ahead because I was going to ask you the next question, but you
What,
continue. Okay.
yeah,
An
what I was
early
trying,
childhood condition in which child's eye does not develop as it should be is the lazy eye. I mean, I've been told it impacts about 1 to 5% of the population. So, what exactly is lazy eye? And are there treatments available for lazy eye? And what are those?
you've done your homework well, Paminder. I must tell you that. Yes, lazy eye is a big, big problem which people should understand. Forget the percentage.
Okay.
But lazy eye means you are anatomically normal, but physiologically you can't see. Now, what
From
is
one eye
which from? Yeah, it could be one eye or both eyes.
or both eyes. Okay.
Yes, you could be lazy partly, or you could be lazy fully in one eye. So maybe 90%
Okay.
laziness in one eye or 70% in the other eye. So it could be monocular or binocular. So lazy eye is called amblyopia in our medical language, and which means
Okay.
if you have a number, remember that's what I was trying to tell you in the previous question also, that remember every child, I force children to go for an eye examination between the age of 3 to 4. And especially if they start
Okay.
blinking a lot, if they start rubbing their eyes a lot, please take
Mm-hmm.
them for eye examination immediately. As I told you, I'll repeat at the cost of repetition. The body and the poor child was trying to tell you something, and
Right.
parents choose to neglect because in their busy schedule, ठीक है चलता है कुछ नहीं. अच्छा ये drop डाल दिया, GP को पूछ लिया, ये drop डाल दिया. This is how things happen. If you are
You
asking me a
ask the chemist
question,
and he just sends over the drops and you just put them and that's it.
fantastic. So again, you postpone the inevitable for a long time, and then they come to me after 4 years,
Mm.
and they'll come and tell the doctor that doctor, despite your treatment for 15 days, it has not worked. Forgetting that last 5 years they wasted time and they did not go to the doctor. So again, every child between 3 to 4 should go for their eye examination. Very important. If parents have a number, either one, mother or father, or the maternal or the paternal side, the grandchild, kaka, kaka, kaki, masi, everybody, if anybody has a number,
Okay.
remember we are offsprings from the great lineage, evolutionary. So just as diabetes runs in families, blood pressure runs in
Mm.
families, your question should have been next, do glasses run in
Mhm.
family? Absolutely, they run in families. Glaucoma runs in
They
families.
do?
So absolutely 100%. You get your blood group from your parent, you get the color of your hair, your color of your skin, your height, your color of your eyes, everything from your parents.
But sometimes I've seen the parents don't wear glasses. They don't have a number, but kids have.
I gave you the answer to that
So,
a fraction of a time back. One, they could not be wearing glasses out of plain simple understanding that they don't want to wear glasses. I have a lot of female patients who have huge number, or for whatever reason they do not wear glasses. All right. And two, I
that
told
I can
you.
understand.
No, you don't. I try to think that because it's pathetic. You know, at least things have changed in the society. 20 years back, it was sad that any child mothers would cry when a child got a number, when a girl got a number. It's pathetic to hear that. At
Right.
least now, after Deepika and all wearing glasses in movies, now it's become a fad to wear glasses. The whole
Mhm. It's
pendulum is
become a
shifting
little
to the other side.
right. So,
Point
in
is,
fact, my
don't,
next question would have been around this contact lenses only. So, we've seen that young people, their confidence is very closely related to their perceived self-image, which is what you've been talking about. So, if they need glasses, if they're not happy wearing those glasses, then it has a very negative impact on their self-esteem. So very often there is a parent question which says, when is it appropriate for my children to wear contact lenses? So is there a particular age from where they can start wearing contact lenses? What should
let me
they do?
finish. Let me finish with glasses, my dear lady. We didn't finish
Right.
with a lazy eye also still. So
Okay.
the
Please,
major,
then
yeah,
let's
the
do that.
major reason for a lazy eye is actually a big glasses number. Now, can
Oh.
you believe what I'm coming to now, where I'm coming from? Because you cannot
Oh.
detect the number in the right time, even the squint in certain children is because of a number. I told you again, I'm repeating. The body wants to tell you something and you choose to neglect.
Mm.
So the if you have a number in one eye, good luck one eye, good luck that you didn't have in the other eye. But since you now bad luck, since you have in only one eye and you can see, you think you can see everything. But when you
Mm.
close one eye, so one of the tests I would give parents home at home for their children and for their own self is once in a fortnight or once in a month while watching television, tell the child to close the eye properly and read some headlines. Now close the other eye and do that now. Why don't you do that now so that you can teach those parents?
So,
Just
but tell me, doctor, children who are below 3 years of age, if you close one, they are not able to read. So, how do you do that eye exam for
you
kids
try,
who
you
can't read
try.
the eye chart?
So that's why you need a doctor. There is a subjective and an objective way of doing it. But remember
Mm.
one thing: even a child is very smart. If they can't see, they will take your hands out. But when they
Yeah, yeah,
follow you, when they follow an object,
right.
you know they are
Then
seeing.
you know.
So we have our ways to find out what's going on with them. But so for elder children, I'm talking of even the elderly age group, because when as girls grow faster, they're sixth, seventh, eighth standard with studies and all that, their number is bound to be there at that point of time.
Right.
So get the lazy eye answer. I'll repeat again is very simple. Determining a number. Doing the lazy eye treatment is very simple. Giving the correct number, and sometimes we have to patch the eye for a few months.
Hmm. So
So
that
the
they use it.
so that that eye which was not being used starts getting used,
Used. Mm.
and then we can in this can happen only till the age of 8 or 10. After 10 years of age, I cannot treat the lazy eye,
Oh.
which is why my point when I told you at the age of 4, please get your eyes examined by an ophthalmologist for your children for the pertaining answer, because if you have saved one eye out of 1,000, you've done your job for today.
Right.
With respect to glasses, I think the perceived understanding of self respect comes from the mother or the father. First thing, mother starts crying, the child feels something is wrong with my mother because I'm wearing glasses. I don't think they have any problem in wearing glasses whatsoever. It's a perceived problem within the family. Then that goosebumps which happens. You rather have your child lazy eye with a squint, or would you like to wear glasses? What do you think is an option? You have an option? No, you don't. Okay,
True.
when can you use contact lenses? I've used contact lenses in a 3-month-old child also, and that child came out to be one of the brilliant minds in the country today. He came into Guinness Book. So when they developed a squint at 3 months, the mother used to wear glasses so she could wear. I made contact lenses for the child. So it's not a question of when to start. So contact lenses are two-part. That
Hmm.
child too small to wear glasses, so I gave contact lenses.
Okay.
However, routinely, it's for cosmetic reason. So why do you want to you
Right.
delay it till the time they are 8, 9, 10, till they start asking desperately in the society circles? As they start growing and they see the gender difference and they start perceiving their value with the opposite sex, let them wear it at that time. So
So, okay. So for those children who are very active in sports, so contact lenses will help them because it means freedom
ab-
from the worry of frames breaking,
absolutely,
etc. So,
absolutely,
are
100%.
there any specific kind of contact lenses for these kind of kids?
Ideal scenario. What is okay? What is the choice? Earlier there was to be hard, semi-soft, and soft.
Daily, that one, my son used to wear for the disposable one.
So
So,
ideal scenario is daily disposable so that you
yeah,
don't get infection.
right.
That is the
Okay.
answer.
Are there any risks which are associated with contact lenses? Can they get any kind of infection, this, that?
100%. You can lose your eye.
Really?
Yes. If you don't clean, that's why remember what I told you. Daily disposable, I said. So
Right.
chances of infection are not there or minuscule chances.
Daily.
Because the monthly and earlier people used to sleep with lenses. Even now, some people sleep with lenses in their eyes. It's the biggest disaster they can ask for in life. Do not sleep with your contact lenses. The moment you wear contact lenses, the oxygen to the eye goes down. And
Right.
then you can't breathe and you can get an infection. Also, once you remove the contact lens, it is mucky, dirty. You don't put it in the bathroom. Keep it clean. Clean it with a solution. You're putting that gem in
Not
your
a
eye.
homemade solution, right? Some people say that, homemade saline solution, they clean their contact lenses.
100%
That's not
no.
the
100% no. 10,000% no. Because the saline solution at home is preservative free without any antibiotics.
right.
So it can get infected. If it gets infected, the lens will be harboring those pseudomonas bacteria, and that's how within a weekend I have seen eyes being lost. So use a proper contact lens solution, which is meant proper. You can use Bosch and Lomb, you can use whichever company, doesn't matter to me.
Okay.
It's available in the market, but they also are bactericidal. They kill the bacteria. So be very careful with contact lenses. Don't take it's like driving a Ferrari. It's nothing wrong in driving a Ferrari, but you love to speed, and then that's where the crash comes.
Right. Okay, doctor, you mentioned briefly about the computer vision syndrome and we talked about the 2020 rule. Now, sometimes the glare on our screens is a problem. So, do you recommend that we should have an anti-glare screen or an eyeglasses? Will that be helpful in any way?
Not really. Not really. Not really. You
Not
don't need to have that.
okay.
I'm sitting with you.
And
I have webinars every day. I'm sitting with you right now.
right,
Not required.
not
So
required.
blink,
And
blink,
what about
palm, blink, palm.
blink? Okay.
Look out, change the gaze.
And okay. What about blue light? Do we need to wear, people are increasingly attentive to light pollution influences on their eyes these days. So we need to wear those special eyewear to block that blue light.
I wish I was selling those glasses. Then I would have told you yes, please wear them. The blue light was always there. The infrared, it's the spectrum between 540 nanometers to 630 nanometers. So that's the one which is there, the blue light spectrum, which is there from the Vibgyor of your life, VIBGYOR,
Right,
the color spectrum. So over
right.
there, it can be used, but unless you are misusing. So what you are hinting at is when you're looking at any kind of an eclipse, the solar eclipse, you need to not have that exposure because you
Yes.
can burn your retina. Routine exposure, let me just put it easier. Have you seen Mark Zuckerberg with that? Have you seen Bill Gates with that? Have you seen Steve Jobs with
No,
that? Does that answer the question?
no.
Does that answer the question?
Okay, I
No.
hope so. The
That,
viewers can understand.
correct. So if
Okay,
these guys with more usage than all of us put together are not using it, so don't worry about it. But if
okay.
you
So
wear them,
that's
is it harmful wearing it? No, it's not harmful.
it's not harmful.
No.
Okay, fine. So it doesn't really add value. Then why should I wear it?
It cuts off a particular wavelength. Yes, in a different scientific form, I'll say for whom it will be required. But is it mandatory that I should be start selling glasses to every child? Not necessarily.
Okay. So, we've seen that we said a lot of time, minimum 8 to 10 hours on either a mobile or a
14 to
computer.
16
And
hours.
okay,
Which is
14 to 16. So we are saying that to minimize the damage, some people think that if you reduce the screen brightness, uh, that helps. So is it true?
yes and no, then you'll strain your eyes. So yes, anything which is too bright, it'll hurt you. You remember, you also will change all that. So
Right.
change the contrast, change all that is fine. I'll show you. Let me share a video for you. Let me share the
Okay.
screen with something
Okay.
interesting.
Sure.
No, you have disabled screen sharing. So if you want, I'll just enable screen sharing.
Uh, okay, fine. Siddesh, we can ask you to enable that.
Okay, whenever he's ready, let me know. Till that time, we can talk.
Okay, fine.
I think Siddesh has gone for a cup of tea.
Maybe. Okay, so sleep deprivation. So can it lead to serious
Enabled.
eye problems?
Yeah, he is
People
enabled
don't
now.
sleep.
Let me just.
Okay, sure, sure. Please show it to us.
Can you see my screen?
We can.
Are you experiencing any of the following symptoms?
Redness, the eyes are getting dry.
Low for a second and itching, sensitive towards the light.
खिंचाव होता है. Irritation,
Redness of the eyes.
burning and stinging sometimes.
Irritation,
My dry eye vision becomes blurry. Yeah, headache.
body sensation, and
I completely dries up. Soreness.
painful. There's a different pain out here on the upper lid.
Discharge too much.
Foreign body sensation.
Irritation in my eyes.
Watery.
Screen for around 12 to 14 hours a day.
Burning.
Too much of water.
Tired in the eye. The water comes out and
I can't see properly. Blurriness in the eye.
more of watering.
Some sort of dryness, some discomfort throughout the day.
Hurting. And your eyeball is hurting. Right eye especially. That feels a bit blurry.
Definitely 10 to 12 hours.
Pain also in the eye. Redness.
Dizzy.
Headache I have a lot.
Blurriness.
That heaviness.
If you are also experiencing such problems, don't be worried. We are here to help you. You can log on to our website and fill in the questionnaire. This will help us understand you better, thus providing you with a customized solution to all your eye problems. We offer monthly solutions that are delivered to your doorstep.
Yeah, so what I'm trying to tell you is that something very simple that is going on right now. As you realize, most of your questions were in that.
Right.
This is what is happening.
Okay. So my
Big one.
So the next question is about sleep deprivation. Does it lead to any serious eye problems? How many hours of sleep?
I'll act like a mirror. You tell me, yes or no.
See,
Your
for me,
answer
I
is
think yes, it may lead to certain issues. But I've seen people and I've seen a lot of film stars who talk about the fact that they sleep for just 3 hours, 4 hours a day, and they seem to be doing quite fine.
and you will believe film stars. Yeah.
No, I mean, I'm
So I'll
just
give you the
asking
answer to that. I'll give you the so no. The narrative given and what is in life is totally different. Please don't get walked away by that. But I'll give you a very scientific answer to that. Everybody's okay. First answer: sleep deprivation. Yes, your full body muscles are tired, so your eye muscles are also going to be tired. Why is sleep being given to you? Even all those people who exercise, they say the first thing that is required, even now in Corona time, if you want to heal well faster, you need to sleep better. You need to eat better, you need to sleep well. So it's a no-brainer at all. So let's not go into that. But if I had to give you an answer, I have a patient. I have a patient and I have a live patient who doesn't sleep for 15 days together, even a blink. Okay? And absolutely fresh and fine. And I have people who sleep 14 hours a day and still are groggy and various kinds of stuff. So remember, the human body is very different. There was nobody like you, and there will be nobody like you later also in this world. So everybody, Napoleon could sleep for a few hours. There are few smart guys who sleep only for a few hours. So deprivation is not the same as the requirement. Each one's requirement is different. You should know what is
Okay.
required for you. What is required for me, maybe 3 hours, maybe for you for 8 hours. So don't go carried away by somebody saying that, oh, I'm a hero and I'll be taking for 4 hours. Your efficiency, if you sleep 4 hours, if you need 8 hours, your efficiency will go down. So even if
So
you
just
sleep
listen
10,
to your body.
again, I'm saying very simple. So I have live examples of people who sleep 2 hours, 3 hours. They are hyper. They keep working. Some of them really feel. And a lot of these people who are insomniacs, ask them how sad they are. They are extremely upset. Look at the amount of sleeping pills people are selling across the market.
Right.
So you rather not have insomnia. If you're having more sleep, enjoy your sleep. That's your best recharging capability. As you realize, there is a battery backup for every phone now. When your
Right.
phone needs recharging, you need recharging.
Right.
So
So an individual's diet also impacts their eye health. So we want to know from you, what are the best foods for healthy eyes?
of course, all vegetables, green, orange, yellows, all those things. Carrots are very good, but a lot of mothers come to me that because number hai to carrot de do. So thinking that numbers will go with carrot, then chashma walas would not be selling chashma, they would be selling carrots. So carrots and all that, very good habit. Salads, making salads, giving fruits, healthy vegetables, all that.
Nuts, almonds, and all.
Yes, of course. Good for memory, good protein, good fatty acid, correct time of protein, long resolution of energy. I'll give you a very dirty example, but I'll tell you something. All those guys, like terrorists and all, what did they find in their pockets? They had dry fruits if they had to survive 48 hours.
Right.
You realize what I'm trying to tell you? When you need energy sustained for a long period of time, little chocolate and dry fruit. You go on mountain training, you go to the Himalayas, you go trekking. Few things that they'll tell you is to keep either some instant booster of energy, which sugar is a chocolate, and or dry fruits. So something of that kind. So yes, all good habits are good. Dry fruits. That's a different chapter on fruits. I can on diet. So good diet, no question, helps you because your body will feel good, bigger and energy, and all berries, antioxidants are good for you. So putting children into a good habit from childhood days, reducing their pizzas, pastas, and the McDonald's will go a
Right.
long way into
So,
their lifestyle in later age group. That is the message I would give.
so the next question is about LASIK eye surgery. It's not right for everybody. So what is it that we should consider as we weigh our decision? Are
Uh,
there any side effects also to
Are you
it?
asking me or telling me that it is not good for everybody?
I'm asking you. There's a big question mark at the end.
LASIK is fantastic surgery. If you don't want to wear glasses or contact lenses, LASIK is the way to go. Okay. My daughter is an ophthalmologist. I have done her LASIK. My son is a Harvard undergrad. I have done his LASIK. So let me just make it easier. So proof of the pudding is skin in the game. Good surgery, very good surgery. The equipments have become fantastic today. No
Okay.
question. So if you have the latest generation equipments with the best softwares available, what is available in the world is available here down the street. So good, very good surgery, no question. But the doctor has to determine whether you are a good candidate or not. 99% of the patients are good candidate. 1% is not a good candidate. So that let the doctor decide
Okay.
which technique, what surgery, what. Your cross question, is it good? Absolutely fantastic surgery. No doubt about it.
Any side effects?
Bilkul.
No,
Why
no
did you
side
go,
effects.
why do you go for laser surgery? Why did you go for laser surgery? Tell me something.
You want to remove the glasses, of course.
So what that means you had a side effect already existing. Were you born normal? If you are normal, did you go? Would anybody who's normal go to a doctor for LASIK surgery?
Of
There was a manufacturing defect. Okay, so the biggest side effect was you didn't want to wear glasses. You cosmetically didn't want to wear it. I have 5,000 interviews on YouTube. Go ahead and see of those of my patients who've done LASIK surgery. Okay, visionize.net. You'll see that. So the purpose of the whole, I'm not saying that everybody should do it or they lose their eyes. I'm not saying that. But what I'm saying is if you don't want to wear glasses, contact lenses, the results are so beautiful that patients have told me that they have never seen so well in prior, even with the best glasses or contact lenses.
So do we need to
So,
wait till the age of 18 for
yes,
kids?
yes, you cannot do laser until 18 years of age. Why? Because they are still growing and the
Okay.
numbers can keep changing till 18. So the
Okay.
answer is till you are 18 or your number remains constant for the past 1 year, you cannot do LASIK. Otherwise, you can do. So between 18 to 80 years of age, we can do it. And by the way, Parvinder, at this point in time today in my practice, 40 to 45% of patients are above the age of 40, 45.
Oh, wow.
What they missed out when they were young, like when we were young, there was no color TV and there was no cell phone.
Right.
So you
Okay.
can cover it now. So don't worry about that.
So, doctor, sometimes we see specks, which are aimlessly moving around in our vision, and it can be bothersome. So, I wanted to know about what are eye floaters, what are the causes and remedies, or is it something to be worried about?
Good question. Very good question. Again, now since this is for children, most children don't have eye problems. They don't have floaters. It's the adults who will get floaters. The
Okay.
floaters are called vitreous floaters. So the two ends of a spectrum. It could be normal, it could be an absolutely disastrous and preposterous to say it is normal. It could be a premonition to a retinal detachment. So if you see sudden flashes of light or floaters,
Mm-hmm.
you see flashes
Mm-hmm.
or black spots suddenly in your, you couldn't see yesterday and today if you see, go see an eye doctor immediately. It could be a premonition to a retinal detachment.
Oh,
Okay. However, there is a jelly called vitreous in your eye. If you remember a little bit of the anatomy of the eye,
Right.
vitreous is a jelly substance like a jelly, which liquefies with age.
Okay.
And that's where you get those floaters in life. So they are a part of your life. Don't get worried. If your doctor has told you that you don't have a detachment, relax. It's just a part of your life. It's like having a mole, it's having a spot in your eye, anywhere like that. So two ends of a spectrum, danger, extreme danger, or it could be safe. 90% of the time it is safe. 5 to 7% of the time it could be dangerous. So get it examined. Don't take it for granted.
Okay. So, on that note, we would like to thank you, Dr. Mehta, for joining us and being a guest on our program. It was a pleasure having you on. And good vision helps you perform well. We all know that. It's important to take a few simple steps to make sure you keep your eyesight at its best. And the best way to prevent an eye problem is to make regular visits to your eye doctor. Thank you for watching.